Hey there, and welcome to Revitalize Mental Health. My name is Daniel Gospodarek, and I'm the owner of this therapy practice based here in Denver, Colorado. Tonight, I wanted to chat a little bit about the differences between trauma and PTSD. So, when we think of trauma, it's highly individualized and it's a very broad category. So, it can include many different pieces, right? From a car accident that maybe led to some minor injuries to losing your job, maybe even finding out that your home or your apartment burnt down while you were at your job, right? So thinking it can be many different things can cause trauma in our lives, right? Even being bullied as a child can be traumatic. Then we go to PTSD, and when we look at PTSD, it's a form of trauma, but it's you have to meet a certain threshold to have this diagnosis or to receive treatment for PTSD. So thinking some of these criterion include real or perceived threat to self. So, meaning, um, did somebody experience death? Were they threatened? Was there was there any sexual violence towards one person or threatened sexual violence, or was there some sort of bodily injury, right? So thinking a car accident. We have these different ways that PTSD can occur in somebody's life, right? We're talking violence, sexual violence, or bodily injury, or even just the threat of some of these things can reach that PTSD level. But where and how can somebody experience these situations, right? So we have direct exposure, right? So being in a car accident is one way, right? That direct contact with the event. We have also being a bystander, so witnessing something. So maybe being a passenger in a car accident, witnessing a car accident, right? Or seeing something traumatic happen, seeing somebody fall or something on that level, right? So being a witness. The other areas that we can experience these types of situations include learning about a traumatic incident that happened to someone we cared about, right? So thinking a family member or a very close friend, and we learn that they just passed or something tragic just happened in their life. And lastly, the other situation where PTSD can occur is this indirect exposure to traumatic material, so or traumatic events. Thinking police, EMTs, medics, and then even morticians, right? Like they're dealing with death all the time and they're seeing some pretty gruesome things. So that then can reach that PTSD threshold. So if you have any other questions on trauma, PTSD, or even this video didn't touch on it, but complex PTSD, give us a call. We'd love to chat more. Thanks. Bye.